pink. Think pink when you shop for summer clothes. Think pink. Think pink if you want that kelp that shows. Red is dead, blue is through, green's obscene, brown's taboo, and there is not the slightest excuse for plum abuse or chartreuse. Think pink.
G'day, gorgeous. So it's quite late in the day here. Daylight savings has finished. I always get really sad, but we're having this beautiful extended Indian summer, so I'm not complaining. I've only got 8 weeks until I go to Europe anyway, so I'm just going to, enjoy it while I can before it starts really getting cold around here. All right, so I can't even begin to talk about what my week's been like. I went last night to see a movie called Resilience, and I was just really excited by the fact that it talks about a study that was done using a thing called ACEs, which the long and the short, these doctors well over 10 years ago in the US decided that they could tell that people were having big major health issues, and they seem to all come from particular pockets around different areas in the US, and they were kind of like, there seems to be some sort of link between mental health and physical health, and if people have adverse childhood experiences, that then that's going to impact on their physical health. Now, you guys who have read my book, so if you haven't read Define Your Inner Diva, then you probably want to grab it. You'll know that I talk about parts of self and how we need to repair the self, and why we have these negative experiences from childhood in that chapter of the book. And it's those issues that affect self that impact how we go into our relationships, what sort of things we do from our work perspective and our career, and how it impacts our health and well-being. Now, from a health and well-being perspective, I've just been talking about, obesity. So I know that, weight gain or excessive weight gain is directly related to our emotional overeating, and some of the issues that I say, why do we need to go back and fix self before we can get our best health outcomes in terms of our weight management and, exercising and looking after ourselves, has always been about this awareness that I had about, the psychological side of health and well-being. And I'd observed even within my own clients that some people who have, quite serious mental health issues also seem to have huge levels of physical health issues. But that was just anecdotal from my perspective. It's just like, no, it's noticeable, but interesting to me, and it was just one of those things I would observe. But this study that came out as part of this whole research project, which has had fantastic outcomes, by the way, shows that the adverse childhood experiences, you only need 4 or more out of the 10 for you to have a massive increase in the outcomes for you in terms of your overall general health. And they looked at things like developing cancer, chronic heart disease, diabetes, obesity, and a lot of the other major physical health issues. And they've discovered actually that they seem to have their basis in these adverse childhood experiences, or in essence what they're talking about is trauma as it is in our early childhood that comes from being in acutely stressful situations, and then because as a society we don't tend to acknowledge the pain that our children experience, and so we kind of think, oh, they're young, they'll just get over it, or they're not talking about it very much, so we don't actually choose to address it. I was just amazed, but really excited in some ways that they've finally got something that clearly shows the link between adverse childhood experiences and the impact that has on our mental health as young people, as children, and then how we carry that with us through our lives, and the impact that it has on our physical health and well-being. And I just think we're kind of edging on the precipice of this really amazing time when we can finally start to see that as human beings, we're holistic human beings, right? That our mind and our body are absolutely 100% connected, and that the way that we think about things is going to impact what happens in our physical body. And even though it was something that we kind of know and we've talked about and we kind of keep it at that level, no, actually, I couldn't believe that finally a doctor, from a doctor's perspective, has chosen to investigate it and found that there's a link. All right. So I hope you find it as interesting as well. I'm going to try and put a link below to the Resilience movie, because I just think it's an astonishing, and I'm so excited that we're finally getting some evidence together that helps support the stuff that I've been talking about for a really long time. All right. See you later, gorgeous.
Pink for cheeks and pink at your lips, pink for shirts and all of your slips, just a touch of pink at your knees, and if you please,